What laser is best for your wart removal? When it comes to removing warts with lasers, there's no one-size-fits-all answer. The best laser depends on the wart's type, location, how stubborn it is, and your individual health. Several lasers are commonly used, each with its own strengths and considerations. The YAG laser, which emits light at a wavelength of 1060 nanometers, is a popular choice. It works by targeting the blood vessels supplying the wart, causing blood flow to stop and the wart tissue to die off. This laser is highly effective, with studies showing clearance rates up to 96%, especially for common and resistant warts. It's often used for warts on the hands, feet, or around the nails. Because it directly destroys the wart tissue, it doesn't rely heavily on patient compliance. Some people might experience pain during treatment, and there's a small chance of bruising or secondary infection. Overall, it's considered safe and effective, with low chances of the wart coming back. The CO2 laser, which uses infrared light at a wavelength of 10,600 nanometers, vaporizes the wart tissue by burning it away. It provides precise removal and has high success rates, often around 80 to 90%. This laser is especially useful for larger or thicker warts. However, it can cause scarring or changes in skin color, especially in sensitive areas. Post-treatment pain and longer healing times are also possible. Because of these risks, it's usually reserved for more difficult cases or when other treatments haven't worked. Diode lasers, such as those emitting at around 577 nanometers, are also used for wart removal. They are effective for smaller, newer warts and can be a good option for delicate areas. Response rates are similar to YAG lasers, but the choice often depends on the specific wart and the doctor's experience. Another option is the YAG laser, which emits light at 2940 nanometers. It causes direct ablation of the skin's outer layer and can be effective for cutaneous warts. While less commonly used, some studies report resolution rates between 70 to 100%. It usually causes minimal discomfort and redness during treatment. It's important to note that other non-laser treatments, such as high-frequency radiosurgery, have shown very high cure rates and might be considered alongside laser options. However, the choice of laser treatment should always be made by a healthcare professional experienced in wart management. For warts related to sexual health and sexually transmitted infections, lasers like YAG and CO2 are often preferred because they offer precise removal and good clearance rates. YAG is especially useful for stubborn or hard-to-reach warts, with a lower chance of recurrence. The CO2 laser can be effective but might carry a higher risk of scarring, so it's important to discuss this with your doctor. Ultimately, the best laser for you depends on your wart size, location, and how long you've had it. Your healthcare provider will consider these factors and your overall health to recommend the most appropriate treatment. Laser removal can be faster and more effective than traditional methods like cryotherapy, but it requires specialized equipment and expertise. Always consult a qualified medical professional to ensure safe and effective treatment. And remember that multiple sessions may be necessary for complete removal.